is Ashley Smith, and this is my final assessment exam. Here's a 360 in my room with my workstation. Hi, I'm Ashley Smith, and I'll be performing your head, eyes, ears, nose, throat, and lymphatics exam today. The first thing I'll have you do is hold this about 14 inches from your face. Do you wear glasses?
No.
Okay, cover one eye for me, and read the smallest line you can.
OLCF.
Okay, go ahead and cover the other eye and read the smallest line you can backwards.
JHDFC.
Okay, so your left eye is 20/25, your right eye is 20/50. Can you uncover both eyes and read the smallest line you can for me?
LTFPH.
Okay, so together your eyes are 20/20. You could consider visiting an optometrist and have them look at your right eye in particular if you'd like. Next, we'll do a visual field screening. I'm going to have you look me in the eyes during this test and let me know when you see my fingers and on which side.
No. 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 No.
Okay, cover one eye for me and let me know when you see my fingers wiggling.
No.
Okay, cover the other eye, same thing.
No.
Okay, so visual fields are intact. Next, I'll look at your lids and lacrimal apparatus. I'm going to press my hands on your face. No lacrimal gland swelling. The lids have adequate closure. The condition of the eyelashes is good. They're all growing in the same direction. They don't seem to be sparse. Can you open your eyes again for me? Just going to open your eyes again. So puncta are present. I don't see any excessive tearing or dryness. Next, I'm going to look at your conjunctiva and sclera. So I'm going to use my fingers to open your eyes. So look up for me. Look down, look to the left and to the right. So sclera is white and has normal vasculature, no chemosis, no jaundice, and the conjunctiva is clear. Next, I'm going to shine a light into your eyes. Okay, I don't see any opacities in the lens or the cornea. Can you look at my light? Okay, the corneal light reflex is present. Next, I'm going to shine a light into your eyes again. So pupils are equal and reactive to light bilaterally. I'm going to have you follow my finger. And there's accommodation and convergence present. Next, I'll have you cover one eye with this card and then uncover. And then do the same thing with the same eye, uncover. Okay, and then can we do it on the other side as well? Uncover, same thing, uncover. Okay, no strabismus present. Next, I will have you follow my finger with just your eyes, not your head or neck. So follow my finger with your eyes. Okay. So conjugate gaze is intact. There's no abnormal extraocular movements such as nystagmus. There's no lid lag. Next, I will do the ophthalmoscopic exam. So when I do this, I'm going to have you look at a point in the distance over my shoulder. I'm going to get really close to your eye before this exam too. So red reflex is present. Okay. And we're going to do the same thing on the other side. I'll get really close to your eye again. Okay, so the optic disc is yellowish orange. It has sharp margins. There's no papillary edema. The vessels are tiny. The margin's sharp and it's round. And the retina has light red arteries, dark red veins, no AV Mickey, no hemorrhages, masses, or exudate. Next, I'm going to do the ear exam. So I'm going to palpate your ears and just inspect them. Any tenderness?
No.
Okay. Any tenderness on that side?
No.
Okay, so the pinna, tragus, and mastoids don't have any deformities, no ulcerations, no swelling, no lesions. Next, I'll look inside your ears. Okay, I can see the tympanic membrane. It's pearly gray, and the ear canals are clear with just a little bit of cerumen. No redness, no bleeding, no exudate. Do the same thing on the other side. Okay, I see a little bit of cerumen, but the tympanic, but the ear canal is clear. There's no redness, swelling, exudate, bleeding, and the tympanic membrane isn't bulging. It's pearly gray on that side as well. Next, we'll go through hearing tests. For the first one, I'll have you occlude one ear with your hand or finger, and then close your eyes and tell me what I'm whispering.
76.
All right, can you do the same thing with the same ear, actually?
84.
Okay, and then the other ear.
64.
23.
I'm sorry, I didn't have them covered.
23.
23.
Okay, so those were all correct. So hearing appears to be intact. Next, I'm going to place this tuning fork on your bridge of your nose, and you tell me if you can hear it better on one side or the other. Does it sound better on one side?
No.
Okay. I'm gonna do something similar. Are you able to hear this?
Yes.
Tell me when it stops.
Stopped.
Are you able to hear this?
Yes.
Okay. And on this other side. Are you able to hear this?
Yes.
Tell me when it stops.
Stopped. I hear it.
Okay. So you passed the hearing test. Next we'll do the nasal exam. So nose is midline, it's symmetric bilaterally. Any tenderness?
No.
Okay, no tenderness. No lesions, no masses. Any tenderness here?
No.
Here?
No.
Okay, so no sinus tenderness. I'll have you occlude one nostril and breathe in. And then the same thing on the other side. Okay, air is moving symmetric bilaterally. Next, I'm going to look in your nose. Tell me if you have any discomfort with this. Okay, have you had your turbinates removed by any chance?
Yes.
Okay, septum is midline, nasal mucosa is pink. Gonna look on the other side too. There's a little bit of white clear mucus, sorry, coming out. But the findings are the same on both sides, no bleeding, no redness. Next, I'm gonna look at your mouth. So lips are pink, they are a little bit dry, but no cracked, not cracked at all, no scaliness, no lesions, no masses, no ulcerations. Next, I'll look in your mouth. Mucosa is pink and moist, all the teeth are present. There are some crowns and potentially some receding gums. I'm gonna do this on the top of the mouth too. No ulcerations, no masses, no swelling or redness. Go ahead and stick out your tongue for me. Just looking at the hard and soft palate. No white patches, no ulcerations, masses, lesions, exudate. Go ahead and stick out your tongue and say ah for me. So uvula rises midline. I don't see any tonsils. Have you had them removed?
Yes.
Okay, can you stick out your tongue for me? Tongue is midline, and then I don't see any ulcerations, masses, lesions on the top or under side of it. Next, we'll do the lymph node palpation. So pre-auricular, I'm doing this on the same spot on each side. Tonsillar, post-auricular, occipital, submandibular, submental, anterior cervical, superficial cervical, posterior cervical. Any tenderness with any of these?
No.
Okay. And then I'm gonna unbutton your shirt real quick. Infraclavicular and supraclavicular. Okay, so no tenderness?
No.
Okay, and I did not feel any swelling either. So that concludes the exam.